healthier families, by fewer premature deaths, by fewer hospital admissions, by fewer children becoming addicted to nicotine before they are old enough to appreciate the lifelong consequences. That is the standard by which this bill should be judged. Mr. Speaker, over the years, the tobacco industry has changed its packaging. It has changed its marketing. It has introduced new products. But one thing has never changed. Its business depends on attracting new customers, new consumers. The uncomfortable reality is that tobacco companies cannot survive unless new users replace those who quit smoking or those who die from tobacco-related disease. That is why the industry continues to invest enormous resources into marketing strategies designed to make tobacco products appear attractive, fashionable, and less harmful than they truly are. Today, Mr. Speaker, those strategies extend far beyond traditional cigarettes. They include flavored tobacco products, electronic nicotine delivery systems, eye-catching packaging, stylish designs, and products specifically intended to appeal to younger consumers. Mr. Speaker, we cannot ignore those realities. Our responsibility is not to react after another generation becomes addicted. Our responsibility is to prevent that addiction from occurring in the first place. That is exactly what this legislation is designed to do. Mr. Speaker, one of the most important principles behind this legislation is that tobacco control cannot succeed if it contains loopholes. Experience from around the world has shown that whenever governments regulate only one product, restrict only one form of advertising, or exempt particular establishments, the tobacco industry simply shifts its focus to those areas left unregulated. That is why the World Health Organization Framework Convention on Tobacco Control promotes comprehensive measures rather than piecemeal approaches. If we leave gaps in this legislation today, those gaps will become tomorrow's problem. This bill therefore adopts a comprehensive approach because experience has shown that comprehensive laws save lives. Partial laws do not. Mr. Speaker, tobacco products should not be treated differently based on how they are consumed. They come in various forms and may be smoked, heated, chewed, or used in other ways. These differences relate only to how the products are manufactured, marketed, and used. What they all have in common is far more important. They all contain tobacco or nicotine. They all expose users to harmful and addictive substances. And where they produce smoke or aerosols, they expose others to substances that can adversely affect health. Whether the smoke comes from a cigarette, a cigar, or another tobacco product, it poses serious health risks both to the user and to those nearby. Mr. Speaker, even where smoke is not deeply inhaled, the lips, mouth, tongue, and throat remain exposed to cancer-causing substances. More importantly, every person in the vicinity is still exposed to second-hand smoke. The danger, therefore, does not disappear simply because the product looks different or is consumed differently. The evidence is clear that no tobacco product is without risk. This bill, Mr. Speaker, establishes a consistent public health framework that applies across tobacco products regardless of their individual characteristics. The objective, Mr. Speaker, of this legislation is not to determine any differences between the tobacco product or whether one is less harmful than the other. The objective of this bill is to protect the health of the Belizean people. Public health policy must be guided by evidence and by the principle of protecting all Belizeans from preventable harm. Mr. Speaker, there is another reason why this comprehensive approach is also so important. The tobacco industry has consistently adapted its products and marketing strategies to attract new consumers. Some products are flavored, some are presented in premium packaging, others are marketed as sophisticated, modern, or less harmful alternatives. Historically, flavored tobacco products have often been marketed in ways that appeal to younger consumers. Their flavors mask the harshness of tobacco. Their colorful packaging attracts attention. Their affordability makes them accessible. Unfortunately, that combination makes them attractive to young people experimenting with tobacco for the very first time. Regardless of their appearances or branding, the concern here remains the same: preventing nicotine addiction and protecting young people from beginning a lifetime of tobacco use. Our objective, Mr. Speaker, is to reduce tobacco use and protect future generations. Our legislation must be comprehensive, evidence-based, and applied consistently to be effective. Anything less will surely undermine the very purpose of this bill, and that is what precisely this bill seeks to achieve. Having established why this legislation must apply comprehensively to all tobacco products, allow me now to turn to another critical pillar of this bill: protecting the public from secondhand smoke, restricting tobacco advertising and promotion, and ensuring that tobacco products can no longer be marketed in ways that mislead consumers or attract young people. As I said, Mr. Speaker, having established why this legislation must apply comprehensively to all the tobacco products, there are three important pillars, and these are creating 100% smoke-free public spaces, prohibiting tobacco advertising, promotion, and sponsorship, and ensuring that tobacco packaging tells the truth about the dangers of tobacco use. These measures are not unique to Belize. They represent internationally recognized best practices that have been proven to reduce smoking, protect non-smokers, and save lives. Mr. Speaker, at its heart, this bill recognizes one very simple principle: every Belizean has the right to breathe clean air. That right should not disappear because someone walks into a restaurant. It should not disappear because someone is employed in a hotel. It should not disappear because someone boards public transportation. Nor should it disappear because someone attends a sporting event or another public gathering. The freedom of one individual to smoke must never come at the expense of another person's health. That is the balance this legislation seeks to achieve, Mr. Speaker. Some have suggested that designated smoking areas or ventilation systems provide sufficient protection. Unfortunately, decades of scientific evidence have shown otherwise. Ventilation systems remove odors. They do not remove the toxic chemicals contained in tobacco smoke. Separate smoking rooms reduce visibility. They do not eliminate exposure. The only measure consistently shown to protect workers and the public is the creation of completely smoke-free indoor environments. That is why this bill adopts that standard. Mr. Speaker, sometimes we focus so much on smokers that we forget another group of people. This debate is also about workers. Every Belizean deserves a safe workplace. No employee or worker should have to choose between earning a living and protecting their health. Workers employed in enclosed environments where smoking occurs deserve exactly the same protection as workers in every other profession. The right to a safe, healthy workplace cannot depend on where someone is employed. It belongs to every Belizean. That principle is reflected throughout this bill. Consider the waitress serving meals throughout an 8-hour shift, the bartender behind the counter, the hotel receptionist, the security guard, the cleaner, the musician entertaining patrons. These individuals may never choose to smoke. Yet, if smoking in enclosed workplaces is permitted in enclosed workplaces, they are repeatedly exposed to harmful tobacco smoke simply because they are earning an honest living. No Belizean should have to sacrifice his or her health to earn a paycheck. This legislation protects those workers. It recognizes that occupational health is public health and that every workplace should be a safe workplace. Mr. Speaker, another important point that deserves mention is that smoke-free laws do not only protect non-smokers, they also help smokers. Experience from countries around the world has shown that smoke-free environments encourage many smokers to reduce consumption or to quit altogether. For those who wish to stop smoking, supportive environments make that decision easier. For young people who have never smoked, smoke-free environments help prevent tobacco use from becoming normalized. That is how cultures change, not overnight, but steadily, one healthier decision at a time. And that is precisely what good public policy should encourage. Mr. Speaker, another major pillar of this legislation is the prohibition of tobacco advertising, promotion, and sponsorship. And I know some may ask, why such a broad prohibition is necessary? The answer is straightforward. Because tobacco advertising works. If advertising had no effect, tobacco companies would not spend millions of dollars promoting their products every year. Advertising creates curiosity and shapes perception. It normalizes behavior, and ultimately it recruits new consumers. So, Speaker, we must never lose sight of one uncomfortable reality. The tobacco industry depends upon attracting new users, and without new smokers, the industry cannot sustain itself. That is why children and young people have historically been among its most important targets. Perhaps not openly, perhaps not directly, but unquestionably through branding, product placement, packaging, sponsorship, and subtle form of promotion. This bill closes those avenues. Children should be influenced by parents, teachers, and positive role models, not by tobacco marketing. Mr. Speaker, this is not simply an international concern. The evidence from Belize tells the same story. As I said earlier, the 2024 Global Youth Tobacco Survey found that significant numbers of Belizean students continue to encounter tobacco marketing at points of sale, through entertainment media, and through promotional items carrying tobacco branding. That should concern every member of this House. Young people are remarkably impressionable. Repeated exposure to tobacco branding increases the likelihood that experimentation will eventually become addiction. And as legislators, we in this room, we have an opportunity and indeed an obligation to interrupt that cycle. Mr. Speaker, this brings me to another important feature of the bill, and I ask members to bear with me. For decades, tobacco companies have used packaging not merely to identify their products, but to market them. Words such as light, mild, smooth, natural, and low tar were deliberately chosen to create the impression that certain tobacco products were somehow safer than others. The science has proven otherwise. There is no safe cigarette. There is no safe cigar. There is no safe tobacco product. This bill therefore prohibits misleading descriptions that create false impressions about reduced harm. Consumers deserve honesty through accurate information. They deserve to understand the risk associated with the products they purchase. That is not an unreasonable expectation. It is common sense. Mr. Speaker, one of the most visible provisions of this legislation is the requirement for large graphic health warnings on tobacco packaging. Some may ask whether these warnings are really necessary. And the answer, of course, is yes. Health warnings are not intended to punish anyone. They are intended to inform. Every consumer has the right to know the risk associated with the product they are buying. Research conducted across many countries has consistently shown that larger graphic health warnings are far more effective than small written warnings in increasing awareness of the dangers of tobacco, encouraging smokers to quit, and discouraging young people from starting in the first place. The package itself should tell the truth, not promote an illusion, not minimize the danger, not disguise the consequences. Simply tell the truth. That is exactly what this bill requires. And Mr. Speaker, the measures in this legislation do not prohibit lawful commerce. The measures regulate a product that has been scientifically proven to cause disease and premature death. Governments regulate pharmaceuticals. Government regulate alcohol. Governments regulate food safety. Governments regulate environmental pollution. We do so because protecting public health is one of the fundamental responsibilities of the state. And tobacco should be no different. Where commercial interests conflict with the health of our people, this government will always place the health of Belizeans first. That is our responsibility. That is our mandate. And that is exactly what this bill intends to do. So, Mr. Speaker, the question before us, before this House, is therefore not whether these measures are reasonable. The evidence clearly demonstrates that they are. The question is whether we are prepared to act on that evidence. As we continue, Mr. Speaker, allow me to address two important questions that have arisen during the consultation process. And I will take a pause to thank the Leader of the Opposition and her members for participating in those consultations that we had. The senators from all members of the upper house, and including parliamentarians who had attended many of these consultations. First, why does this bill prohibit the sale of electronic nicotine delivery system, commonly known as electronic cigarettes or vaping devices? The second question, why does the bill provide for strong enforcement measures and meaningful penalties? These are legitimate questions and they deserve clear answers. Mr. Speaker, when many people think about tobacco control, they think only about traditional cigarettes. Unfortunately, the marketplace has changed dramatically. Today, we are confronted by a new generation of nicotine products that are often marketed as modern, fashionable, and supposedly safer alternatives. Many of these products are brightly colored, flavored, and are deliberately designed to resemble everyday consumer items. Some look like mobile phones. Some resemble cosmetic products. Others are designed to resemble toys or electronic gadgets. Mr. Speaker, we should ask ourselves a simple question. Who are these products really designed to attract? Certainly not lifelong smokers. They are designed to appeal to young people. They are designed to make nicotine addiction appear harmless. They are designed to normalize behaviors that previous generations worked hard to discourage. And that is why governments across our region and around the world are taking decisive action. This bill, Mr. Speaker, follows that same evidence-based approach by prohibiting the manufacture, importation, distribution, and sale of electronic nicotine devices or vaping devices. Mr. Speaker, perhaps the greatest responsibility of any government is not simply to solve today's problem. It is to prevent tomorrow's. If we wait until another generation of Belizean children become addicted to nicotine through vaping products, we will have failed in that responsibility. We have already heard certain concerns expressed by parents, teachers, health professionals, community leaders. Many have observed these products becoming increasingly visible and increasingly accessible. Some have expressed concern that children are using these products because they believe they are harmless. Mr. Speaker, nicotine addiction is never harmless. Whether delivered through a cigarette, a cigar, or an electronic device, addiction remains addiction. Our responsibility is to interrupt that pathway before it becomes another public health crisis. And that is exactly what this bill intends to do. But, Mr. Speaker, we could hear and we could make good laws, but it requires effective enforcement. A law without enforcement is merely a suggestion. If this legislation is to achieve its objectives, compliance must also be taken seriously. That is why the bill establishes penalties for violation. Some have suggested that these penalties are too severe. I respectfully disagree. The purpose of these penalties, Mr. Speaker, is not to punish unnecessarily. Their purpose is to encourage compliance. Experience around the world has shown that weak penalties do not change behavior. They simply become another cost of doing business. Meaningful penalties, on the other hand, encourage responsible conduct, support fair enforcement, and create a level playing field for everyone. Mr. Speaker, another important principle reflected in this legislation is that responsibility should rest with those who are in a position to ensure compliance. Business owners and managers have responsibilities. Retailers have responsibilities. Importers have responsibilities. Manufacturers have responsibilities. Individuals also have responsibilities. This bill recognizes that effective tobacco control requires cooperation from everyone. It is not enough to expect individual smokers alone to comply. Those responsible for operating businesses and public premise must also play their part in protecting employees and patrons. That approach, Mr. Speaker, is entirely reasonable. It encourages education before enforcement, cooperation before confrontation, and ultimately compliance before penalties. Mr. Speaker, let me also make one point abundantly clear. The purpose of these penalties is not to generate revenue for government. If every person complies with this law, government will collect nothing in fines. And that would represent success. Success means healthier communities. Success means cleaner public spaces. Success means fewer children beginning to smoke. Success means families losing loved ones to prevent, fewer families, losing loved ones to preventable diseases. That, not revenue, is the objective of this legislation. And there is also, Mr. Speaker, another important principle that deserves mention. Throughout history, public health legislation has often encountered resistance from industries whose commercial interests are affected. We have seen it with seatbelt laws. We have seen it with drink driving legislation. We have seen it with food safety standards. And we have seen it repeatedly in tobacco control. That should not surprise us. The responsibility of government is fundamentally different from the responsibility of any commercial enterprise. Businesses exist to generate profit. Government exists to protect the public interest. Those are not always the same objective. When they conflict, however, government must always place the health and well-being of its citizens first. And that is what this legislation, Mr. Speaker, intends to do. Let me also say this. This government values the contribution that legitimate businesses make to our economy. We appreciate the investments they make. We appreciate the employment they provide. We appreciate their contributions to national development. Nothing in this legislation should be interpreted as hostility towards legitimate enterprise. On the contrary, businesses thrive best in healthy societies. Healthy workers are more productive. Healthy customers participate more actively in the economy. Healthy communities are stronger communities. And this bill therefore seeks not to undermine business, but to ensure that commercial activity takes place in a manner that respects the health and safety of the Belizean people. That is reasonable expectation in any modern democracy. Mr. Speaker, every generation of legislators is presented with defining moments. Moments when we must decide whether to maintain the status quo or whether to act in the long-term interests of our country. Public health reform has rarely been easy. Many of the measures we now take for granted, mandatory seat belts, motorcycle helmets, child immunization programs, food safety regulation, and drink driving laws, were all once controversial. Today, they are widely accepted around the world because they save lives. I have no doubt that in time, comprehensive tobacco control will be viewed in that very same way. History has consistently shown that when government acts courageously to protect public health, society benefits. Mr. Speaker, one of the questions that has also surfaced throughout the public consultation is whether this legislation will negatively affect businesses, particularly those in the tourism and hospitality sector. It is an understandable question. Whether government introduces significant public health legislation, concerns are naturally raised about possible economic consequences. Yet history has repeatedly demonstrated that protecting public health and promoting economic growth are not opposing objectives. In fact, they reinforce one another. Healthy societies build stronger economies. Healthy workers, as I said, are more productive. Healthy families are more financially secure. Healthy children perform better in school and become healthier adults. That is why, Mr. Speaker, this legislation is not only a public health investment, it is also an economic investment. Mr. Speaker, too often, public debate presents us with a false choice. We are told that we must choose between protecting health and protecting business. That is simply not true. The evidence from countries around the world demonstrate that comprehensive smoke-free legislation does not damage legitimate businesses. In many instances, businesses continue to prosper. Restaurants continue to operate. Hotels continue to welcome visitors. Entertainment venues continue to thrive. Tourists continue to travel. Life goes on, but in cleaner, healthier environments. And we say why? Because the overwhelming majority of people do not smoke. Families appreciate smoke-free restaurants. Visitors appreciate smoke-free hotels. Employees appreciate healthier workplaces. In fact, many establishments experience increased patronage because more people feel comfortable spending time in smoke-free environments. That has been the experience across numerous countries that have implemented comprehensive tobacco control legislation. So, Mr. Speaker, the evidence is remarkably consistent. Protecting public health does not weaken responsible businesses. It strengthens them. As Minister of Health and Wellness, Mr. Speaker, I have tremendous respect for our Belize's tourism industry. Tourism is one of the pillars of our national economy. It creates employment. It supports families. It showcases Belize to the world. Nothing in this legislation seeks to undermine that success. On the contrary, today's international traveler increasingly values destinations that are clean, safe, and health conscious. Visitors come to Belize because of our magnificent barrier reef, our rainforest, our rich Maya heritage, our wildlife, our hospitality, our culture. They do not choose Belize because smoking is permitted indoors. Indeed, many of the world's leading tourism destinations, including several in our own region, have already adopted comprehensive smoke-free legislation while continuing to experience growth in visitor arrivals and tourism revenue. Protecting clean air is entirely consistent with protecting Belize's reputation as a premier tourism destination. I'm almost finished. While much attention, Mr. Speaker, is given to the commercial sale of tobacco products, far less attention is paid to the enormous cost tobacco imposes on society. Every tobacco-related illness has a cost. Every preventable hospital admission has a cost. Every premature death has a cost. Every worker forced to leave the workplace because of tobacco-related disease has a cost. Every family that loses its primary breadwinner bears a cost that can never be measured. These costs are borne by individuals and families, by our national health system, by employers, and by taxpayers. And ultimately, they are borne by the Belizean economy. Research estimates that tobacco use costs Belize nearly 20 million Belize dollars every year through direct health care expenditure and lost productivity. That includes approximately 2.76 million in healthcare costs alone, with substantially greater losses resulting from reduced productivity and premature deaths among working age adults. Mr. Speaker, that is money that could otherwise be invested in schools, roads, community development, public safety, or strengthening our healthcare system. Instead, we spend it treating illnesses that are in many cases preventable. That is a concern and should be a concern for every member in this House. As the old adage, they always say, there's an old saying in medicine, prevention is better than cure. My team said they will go one step further. Prevention is also less expensive than cure. Every case of cancer prevented, every heart attack prevented or avoided, every stroke that never occurs, every child who never becomes addicted to nicotine represents a saving not only in healthcare costs, but in human suffering. No legislation can eliminate disease entirely, but good legislation can reduce risk. It can create healthier environments. It can encourage healthier choices. It can save lives. And that's what we aim to do in this bill. Mr. Speaker, as legislators in this room, and I look around this room at all my colleagues on both sides, we are entrusted with making decisions that extend beyond our own terms in office. Some decisions affect the next budget. Others affect the next election. But a few decisions shapes the future of an entire generation. I believe this is one of those decisions. 20 years from now, I hope Belizeans will look back and say that this Parliament had the courage to act, that we chose prevention over complacency, that we chose science over misinformation, that we chose children over commercial interests, that we chose public health over political convenience. Those are the choices that define responsible leadership. Mr. Speaker, Belize has often demonstrated leadership in public health. We have strengthened immunization programs. We have improved maternal and child health. We have expanded access to healthcare services. We have confronted emerging diseases with determination and resilience. Today, we have another opportunity to lead. Not because international organizations ask us to, not because other countries have done so, but because it is the right thing to do for Belize. Passing this legislation sends a clear message that the health of our people remains one of this government's highest priorities. It says to every parent that we are committed to protecting their children. It says to every worker that their health matters. It says to every Belizean that this Parliament is prepared to make decisions based on evidence, compassion, and the long-term interest, national interest of its people. That is the kind of legacy worthy of this honorable House. Mr. Speaker, I have spoken today about the science, about the health consequences. I have spoken about protecting our young people and our workforce. I have also spoken about our economy. Allow me now, in closing, to return to the central question before this honorable House. Why should we pass the Tobacco Control Bill? Because it is the right thing to do. Because it is the responsible thing to do. And because future generations of Belizeans deserve nothing less. As I conclude this debate, my presentation, let us return to the simple question, Mr. Speaker, why are we here today? We are here because too many Belizeans continue to suffer from preventable diseases. We are here because too many families have watched loved ones battle cancer, heart disease, stroke, and chronic respiratory illnesses. We are here because too many children are being exposed to tobacco smoke before they are old enough to understand its dangers. And we are here because we have the power and the responsibility to change that reality. Mr. Speaker, legislation is ultimately judged not by the debates that surround it, but by the lives changed. Years from now, Belizeans will not remember every speech delivered in this chamber or every procedural step or amendment that brought this bill to its final passage. But they will remember whether this Parliament had the courage to act when the evidence was clear and the opportunity was before us. That is the decision we are making today. Mr. Speaker, every generation of legislators leaves its mark on the nation. Some build roads, some build schools, some reform institutions. Others pass laws that quietly improve the quality of life for generations to come. I believe the Tobacco Control Bill belongs in that category. Its success will not be measured by the headlines tomorrow morning, or Channel 7 or Channel 5 or whatever news station, but measured over the years ahead by fewer young people becoming addicted to nicotine and by fewer parents grieving the loss of loved ones to preventable diseases. It will be measured by healthier workplaces and public spaces, lower healthcare costs, stronger families, and ultimately a healthier Belize. That is the Belize we are striving to build. So, Speaker, I do not believe this should be viewed as a government bill or an opposition bill. This is a Belize bill. Cancer or heart disease do not distinguish between political parties. Secondhand smoke does not recognize constituencies. Disease affects us all, and protecting the health of our people must remain one of the few causes capable of uniting us across political differences. I therefore appeal to every member of this Honorable House to consider this legislation not through the lens of politics, but through the lens of public service. Each of us took an oath to serve the people of Belize, and today we have an opportunity to honor that oath. Mr. Speaker, there is an African proverb that says, "A society grows great when old men plant trees, whose shade they know they shall never sit in." In many respects, this bill is one of those trees. Some of the greatest benefits will be realized by the next generation, and that is the legacy this legislation offers. As Minister of Health and Wellness, I have had the privilege of meeting countless Belizeans whose lives have been changed forever by chronic disease. I have spoken with patients and comforted families during my visits at hospitals and clinics across this country. I have seen the extraordinary dedication of our doctors, nurses, community health workers, and every member of our healthcare system. Their commitment inspires us every day. But even the very best healthcare system cannot undo every consequence of tobacco use. Treatment is essential, but prevention is even more powerful. That is why, Mr. Speaker, this legislation matters. This bill represents one of the most important preventative health measures our country has considered in decades. History, Mr. Speaker, has shown that the greatest advances in public health have often required political courage. There was a time, as I said before, where seatbelt laws were controversial. There was a time when motorcycle helmet laws were questioned. There was a time when laws against drinking and driving were resisted. Today, we would argue that those decisions were mistakes. Instead, they are recognized as measures that have saved countless lives. I am confident that the comprehensive tobacco control will one day be viewed in exactly the same way. When future generations look back on this Parliament, I hope they will say that when confronted with overwhelming evidence, we chose action over delay. When future generations, that when confronted with powerless interests, we chose the public interest. That when confronted with uncertainty, we relied on science. And when confronted with a choice between convenience and responsibility, we chose responsibility. Mr. Speaker, every day our doctors, nurses, pharmacists, community health workers, public health inspectors, laboratory professionals, and every member of our healthcare team work tirelessly to treat disease and restore health. They do so with extraordinary dedication and compassion. Today, Through this legislation, this honorable House has an opportunity to stand beside them, not in the clinic or in the operating theater, but in this chamber, by preventing disease before it begins. There can be no greater expression of our commitment to the health and well-being of our Belizean people. I am now wrapping up, Mr. Speaker. So today, we have an opportunity that few parliamentarians are ever given. An opportunity to pass legislation that will improve public health, protect our children, support our workers, reduce preventable disease, strengthen our healthcare system, and improve the quality of life of the Belizean people. This bill is not limiting freedom. It is expanding the freedom of every Belizean to live a healthier life. The freedom of every child to grow up free from nicotine addiction. The freedom of every worker to breathe clean air. The freedom of every family to enjoy more years together. Those are the freedoms worth protecting. Mr. Speaker, the health of our nation is one of our greatest national assets. Healthy citizens build strong communities, and strong communities build a strong nation. A strong nation secures a brighter future for every Belizean. Let us therefore rise above division. Let us be guided by science. Let us be guided by our duty to those we represent. And let us send a clear and unmistakable message that Belize values life, values health, and values the future of its people. With those remarks, I respectfully commend the Tobacco Bill 2026 to this Honorable House and humbly ask all members to lend their full support. Thank you very much.
Recognize the member from Albert.
The member for Albert is standing.
I should first.
Thank you. Thank you, Mr. Speaker, and I apologize to the member for Belize Rural Central. I believe you chance me, member from Orange Walk. Yes, indeed, this bill has been a long time in coming. 20 years, when I had the opportunity to meet with the members from the Ministry of Health and with PAHO and WHO, the World Health Organization, it's been some time in coming. I feel it like it took you all 20 years to write that presentation, Honorable. I believe this bill was first introduced in the House sometime last year, October or November. And so you would imagine my surprise, Mr. Speaker, when I got the supplemental orders late last night and saw that the bill was finally back on the agenda for second reading. They did not give me as much time to compete with your lengthy intervention, Honorable. But I rise this afternoon on behalf of the opposition to contribute to the debate of the Tobacco Control Bill of 2025. This bill, as we have heard repeated in the Minister's presentation, seeks to implement Belize's obligations under the World Health Organization Framework Convention on Tobacco Control by establishing a comprehensive legal framework addressing smoking in public places, packaging and labeling, advertising, sales enforcement, and tobacco control policy. Mr. Speaker, there can be little disagreement that smoking remains a significant public health concern. Every year, as the member so carefully and copiously outlined, tobacco-related illnesses place enormous pressure on our healthcare system while causing preventable deaths and suffering. The protection of children from nicotine addiction and exposure to secondhand smoke is an objective we all support. The opposition, therefore, supports this bill, this piece of legislation, in principle. As legislators, however, our responsibility extends beyond agreeing with good intentions. We must ensure that every law enacted in this House is balanced, enforceable, proportionate, respectful of constitutional rights, and capable of practical implementation. We believe there are aspects of this bill that deserve closer scrutiny to ensure that it is balanced, enforceable, proportionate, respectful of constitutional rights, and capable of practical implementation. And there might be 5 or 6 elements, if I can raise them now, Mr. Speaker. One is the excessive reliance on ministerial regulations. Throughout this bill, Parliament is repeatedly asked to delegate significant legislative authority to the minister. The minister is empowered to prescribe numerous substantive matters by regulations, including smoking restrictions, health warnings, packaging requirements, product standards, advertising restrictions, reporting obligations, and even plain packaging requirements. Many of these provisions affect private property rights, commercial activity, and criminal liability. While we agree that regulations ought to be made, it should have and it should require parliamentary oversight. Parliament should not surrender its legislative authority through broad regulations, regulatory making powers. Major policy decisions ought to return to this House for debate whenever possible. The other area of concern, Mr. Speaker, is the National Tobacco Control Committee. The bill establishes a 15-member National Tobacco Control Committee appointed by the minister. While broad representation is welcome, questions arise. What objective criteria will guide these appointments? How will independence be protected? Will committee recommendations be published? Will annual reports be tabled before Parliament? Public confidence depends upon transparency. The third matter that we believe requires some greater review is enforcement capacity. Mr. Speaker, the bill creates extensive enforcement powers. Authorized officers are empowered to inspect premises, seize products, examine records, collect samples, and conduct investigation. As the member from Orange Walk East, outlined very carefully, laws without enforcement is a mere suggestion. We agree with that. The obvious question then is, does the ministry currently possess sufficient personnel, financial resources, and technical capacity to effectively enforce these provisions? Legislation without implementation simply creates unrealistic expectations. If government intends to create a modern enforcement regime, then adequate budgetary resources must accompany these new responsibilities. The member also noted, Mr. Speaker, that weak penalties do not change behavior. And he's right. The bill imposes very substantial fines. $250,000 for selling tobacco products to a child. $100,000 for certain advertising violations. $50,000 for certain failures by persons responsible for smoke-free premises, and imprisonment for obstruction of authorized officers. Mr. Speaker, we need some of those penalties enforced for the pilfering of the public purse, not for smoke-free environments. While deterrence is important, Parliament must always ask whether penalties remain proportionate and consistent with penalties imposed under comparable legislation. Justice, Mr. Speaker, requires consistency. And then there is the practical impact on small businesses. Many small retailers across Belize legally sell tobacco products. This bill introduces extensive compliance obligations regarding, as we've said before, packaging, product display, age verification, advertising, reporting, and product standards. The question is, have we consulted adequately with these businesses? Have we assessed how these new compliance obligations are going to impact the way they conduct their business? Will adequate transition periods be provided? Compliance, you see, can only happen if it's achievable, and compliance should never be punitive by default. The opposition fully supports the provisions prohibiting the sale of tobacco products to persons under the ages of 18 and under. We also support mandatory age verification before every sale. Protecting our young Belizeans from nicotine addiction is unquestionably in the national interest. Likewise, protecting workers and the public from secondhand smoke is a legitimate public policy objective. The bill establishes comprehensive smoke-free environments covering workplaces, public transport, and many indoor and outdoor public spaces. Public health considerations justify many of these measures. Nevertheless, public education must accompany enforcement. As the member for Orangewood Walk East articulated clearly, laws alone do not change behavior. Enforcement alone do not change behavior. Education changes behavior. One of the strongest features of this bill is the emphasis is placed upon education and smoking cessation programs. The minister is required, according to the bill, to establish evidence-based public awareness campaigns together with cessation services and counseling. The success of this legislation will depend far more upon prevention than punishment. Helping people stop smoking is ultimately more effective than merely imposing fines. Mr. Speaker, the bill represents a significant modernization of Belize's tobacco control framework. We can agree to that. And the opposition supports the objective of safeguarding public health. We agree with that. We encourage government to carefully consider strengthening parliamentary oversight over regulations, ensuring transparency in appointments, providing sufficient enforcement resources, reviewing the proportionality of penalties, and supporting compliance by legitimate businesses, and prioritizing public education along with enforcement. Good public health policy should not only protect lives. It must also reflect sound governance, transparency, fairness, and the respect for the rule of law. If these concerns are properly addressed, this legislation can achieve the things that the member for Orange Walk East outlined in his presentation. This legislation can become an effective instrument of protecting present and future generations of Belizeans from the harmful effects of tobacco use. Mr. Speaker, prevention is better than cure, and education is better than penalties. Prevention is less expensive, and a healthy population can only ensure a more productive Belize. I thank you, Mr. Speaker.
I recognize the member from Belize Rural Central.
Thank you, Mr. Speaker. Good afternoon, everyone, members on both sides. I, of course, stand to give full support to this tobacco control bill. The Minister has given a very comprehensive, very comprehensive overview, and we thank him and his team for bringing this bill today, and we're very grateful that we've seen every single aspect of it. I give my full support, but I wish to make one or two small remarks, Minister. You know, there's a little saying that the bigger the committee, the more they talk and the less that gets done. So I'm hoping that the National Tobacco Control Committee will get the work done. 15 members. I hope. Not 15? 9 members. Okay, it was amended. All right. So it's 9 members. Good. A good idea to get things done. And Mr. Speaker, I would like to say that in terms of the places where it will be protecting people from secondhand smoke, you will have any indoor workplace, reading from the bill itself now, any part of any public place that is an indoor space, any means of public transport, any means of transport at the time transporting a child, very important, and a person shall not smoke in the following outdoor places: any area within 8 meters from a window, anywhere on the premises that is 5 meters from the outside boundaries of any public place, any waiting area, park, playground, amusement park, stadium area, historic site, public space for the service of consumption of food and drink, any public place where smoking may pose a fire or other hazard, or any other outdoor public space specified in the regulations. Very encouraging, Mr. Speaker. And I would also like to mention that in the second schedule, examples of public spaces, public places where smoking is prohibited: government buildings and compounds, all health institutions and facilities, public or private, all educational institutions and churches, public transportation including terminals, childcare facilities, very encouraging, private business where the public accesses services including lobbies of banks, hotels, restaurants, bars, cafes, and other eating or drinking establishments, entertainment facilities including clubs, cinemas, concert halls, theaters, and game arcades, gaming machine venues and casinos, publicly owned facilities rented out for events, and any other indoor place accessible to the public specified in the regulations. Mr. Speaker, I went through that because I am very concerned about the protection of young people coming up and children in particular. And I do want to say that with the comprehensive nature of the legislation, I think that good things will come. We take the points that have been made, and once again, I want to thank the Minister and his team for bringing this forward and to give the full support to the legislation this afternoon. Thank you, Mr. Speaker.
I recognize the member from Port Loyola.
Good afternoon, Mr. Speaker, and good afternoon, other members of this House. Mr. Speaker, I rise to make my contribution to the Tobacco Control Bill. Mr. Speaker, I ask for your permission to refer to my notes. Mr. Speaker, research shows smoke-free environments have a neutral or positive impact on tourism and generate benefits for tourists and other stakeholders. Empirical studies have found no negative effects on tourist arrivals, tourism expenditure, or average length of stay, even in countries or in regions which represents a major economic activity. On the contrary, evidence shows higher revenues in hospitality venues and increased customer satisfaction. Healthy, clean environments makes a country more attractive to tourists, and implementing smoke-free laws support this. Mr. Speaker, taking a look at tourism and healthcare, the tobacco epidemic also affects the economy by placing a significant burden on the public healthcare system to treat the non-communicable diseases it causes. The passage of tobacco control legislation will significantly reduce the large sums of money expended by the government on the treatment of NCDs, for which use of tobacco products and exposure to tobacco smoke are risk factors. Mr. Speaker, it is the poor who are disproportionately affected by the tobacco epidemic. It is the poor who are disproportionately affected when they prematurely lose a breadwinner to the tobacco epidemic, worsening the cycle of poverty. Those are the costs which governments cannot ignore. Those are the costs which are preventable with the implementation of effective legislation to control the tobacco epidemic. Mr. Speaker, I can speak of the danger of tobacco to good health from experience. In my youth, I became a heavy smoker of name brand cigarettes such as Salem, Winston, Moore, and Piccadilly. The habit lasted for a few years until the smoking of cigarettes began to severely affect my ability to breathe, especially when I engage in outdoor activities, including exercise. Mr. Speaker, I must also state that quitting the use of tobacco for my own health was an uphill battle until I finally quit smoking cigarettes altogether in my late 20s. Mr. Speaker, on behalf of the residents of Port Loyola, I fully support the Tobacco Control Bill.
I recognize the member from Dangriga.
Mr. Speaker, sorry, I think I'm slow to the draw. Thank you for the opportunity, Mr. Speaker, for me to rise, and first of all to commend the member from Orange Walk East and Minister of Health for a brilliant and persuasive presentation. We're talking, and also to commend his team, who certainly were part of and parcel of this presentation today. We're talking about behavioral change, and that is always a difficult matter to deal with. When we're talking about behavioral change, there are a lot of calculations that we might want to make. But I think if we think a little bit more deeply on the matter, we will see that the costs are too high for us to allow more years to pass before we make these changes that are critical for our country's sustainable human development. Similar to what we deal with in the transport sector, and the member mentioned this in his presentation. You have issues about motorcycle riding, helmets, noise pollution, etc. All of these things require that we take bold actions. Because if we don't, what ends up happening is that more and more persons begin to believe that this is the norm, that this is how it should be, this is how it's always been. And so it becomes ingrained and it becomes more difficult for us to change behavior. As the member from Albert correctly pointed out earlier, there are three components that we look at in these matters. We look at the education component, we look at the legislation, and we look at the enforcement. And I would like to humbly suggest to her that all of these elements must work together. It is not that one is more important than the other. It's that we must consider all the three of them. And clearly, in the minister's presentation, he made that very clear. We must explain to our people why it is that the law is needed. Why it is that by making these changes, we are in fact beginning now to respect the rights of the majority of people. What we've been doing in the past is allowing a minority to dictate our behavior. Now, with a proper explanation, I believe people begin to support these important changes that we need to put in place. The law is comprehensive. It has benefited from significant consultations, and that's critical. And of course, the enforcement component must be put in place so that then the three will come into alignment. Because without the enforcement, just like in the transport sector, if we don't enforce that the motorcycle riders are using proper helmets, then it's just a law on the books. And they will continue to do what they're doing. And so in the case of transport, our ministry has been extremely grateful for the decision of Cabinet to increase the number of wardens that we have out on the highway to be able to enforce. And in a similar way, this presentation by the Minister of Health has made it clear that this will now require necessary resources for us to be able to properly ensure that we move to a different behavior. And that is one of the hallmarks of this administration, the John Briceño administration, is that we are not afraid to look at difficult situations and to do the proper analysis and to do the proper consultations and then to take the actions that are needed for us to move our country forward. So on behalf of my people from the Dangriga, Hope Creek and Sarawi constituency, I want to fully support this bill. Thank you, Mr. Speaker.
I recognize the member from Corozal Bay.
Good afternoon, Mr. Speaker. Permission to refer to my notes? We've already heard extensively, Mr. Speaker, from the Minister of Health on the many, many reasons and the many issues that tobacco use causes. But I rise today in support of the Tobacco Control Bill of 2026. But I want to do so and speak from the perspective of the Ministry of Human Development, Family Support, and Gender Affairs, which is the ministry entrusted with protecting Belize's most vulnerable citizens, strengthening families, advancing gender equality, safeguarding children, and ensuring that no Belizean is left behind in our nation's development. Mr. Speaker, every ministry in this honorable house has a role to play in building Belize. Some ministries in government build roads, some build schools, others strengthen our economy, but the Ministry of Human Development builds people. The Ministry of Human Development works with families in crisis. We protect children from abuse, neglect. We support older persons and persons with disabilities. We empower women. We strengthen communities. We invest in human dignity. And I want to go back and say that this bill is not simply a health bill. It is also a human development bill. It is a child protection bill and a family strengthening bill. It is a gender equality bill. And most importantly, Mr. Speaker, it is a nation building bill. Tobacco remains, as we've heard, the only legal consumer product that when used exactly as intended, kills the majority of its long-term users. And so I believe that no responsible government can ignore that basic reality, and no responsible parliament should delay acting upon that information. No responsible society can allow or should allow commercial interests to outweigh the health and the very future of its people. At the Ministry of Human Development, Family Support and Gender Affairs, we often encounter the consequences of hardship after the damage has already been done. We meet the child who has lost a parent. We assist the grandmother raising grandchildren because illness has robbed an entire family of its primary caregiver. We support women who have sacrificed employment opportunities to care for relatives suffering from chronic disease. And the ministry intervenes when families descend into poverty because a breadwinner can no longer work. Behind each of the statistics that were given today is a Belizean family. And behind every tobacco-related illness is a child whose future becomes even more uncertain. Because every premature death is a household whose stability is altered forever. And that's why this legislation matters. We have to recognize that poverty is not merely about income. Poverty is often driven by illness, loss of employment, family instability, and unexpected crises that overwhelm households. And so when tobacco-related diseases remove a family's primary source of income, that's when the social protection systems invariably become that much-needed safety net. Because families will require financial assistance, children will become vulnerable, educational attainment suffers, household resilience weakens, and the cycle of poverty deepens. The greatest social protection policy that we have is therefore prevention. And every preventable illness avoided is one less family requiring emergency assistance. Every premature death prevented is another family able to remain economically stable. Every young person discouraged from tobacco use represents one more citizen that is able to contribute productively to Belize's future. Mr. Speaker, children do not become consumers by accident. They're turned into addicts, because that's the word we don't want to use, but that's what it is. They become consumers first because they're exposed, they're influenced, and they're targeted relentlessly. The tobacco industry understands something that we cannot forget, and that is that it secures the attention of young people today because it needs to secure its future profits for tomorrow. And that's the whole reason why flavored tobacco exists and attractive packaging exists. These are innovations intended to attract young people. The marketing strategies are to recruit them. And so, Mr. Speaker, as the Minister for the Ministry that carries the statutory responsibility for child protection, that responsibility extends beyond responding to abuse after it occurs. It requires us to advocate for laws that prevent harm before it ever begins. And this bill does precisely that, by restricting the advertising, prohibiting the promotion and sponsorship, regulating the packaging, introducing the graphic health warnings, and all the other elements. This legislation places the welfare of Belizean children ahead of commercial profit. And that's exactly where it belongs. Mr. Speaker, this debate is about families. It's about how strong families create strong communities creating a stronger Belize. It also highlights, conversely, that chronic illness places extraordinary burdens on Belizean households. It disrupts family life, it interrupts children's education, it increases healthcare costs, and creates emotional trauma for all involved. It places additional responsibilities on spouses, grandparents, siblings, and extended family members. Because illness rarely affects one individual alone, it affects the entire family. And when families struggle, Mr. Speaker, communities struggle. There's also a profound gender dimension to this legislation, which I think has not been mentioned, because women continue to shoulder the overwhelming share of unpaid caregiving responsibilities throughout Belize. Because when an illness enters the home, Mr. Speaker, it is frequently the mothers, the wives, the daughters, and sisters who reduce their employment, who postpone educational aspirations, who sacrifice economic opportunities in order to care for loved ones. And I have to make that point, that these sacrifices often remain invisible. And yet, they are among the greatest of hidden costs of tobacco use. Our national gender policy commits Belize to removing barriers that prevent women and girls from achieving their full potential. Reducing preventable disease supports that commitment. Healthier families create greater opportunities for women to participate fully in every aspect of life, including education, employment, entrepreneurship, leadership, and public life. Gender equality cannot flourish where preventable illnesses continue to consume family members and family resources. Mr. Speaker, the ministry continues to strengthen community-based family support interventions because we understand that resilient families are built through prevention, early intervention, and coordinated support. This bill embraces precisely those same principles. So rather than waiting until illness overwhelms families and public services alike, it seeks to prevent the harm from occurring in the first place. This is sound public policy, it is responsible governance, and it is compassionate leadership. Mr. Speaker, much has already been said about secondhand smoke, but just allow me to point out the very obvious, that children do not choose the air or the quality of the air that they breathe, and infants cannot remove themselves easily from smoke-filled environments, and even older persons cannot always relocate the way they would like to. Persons with disabilities often have limited mobility. Workers cannot reasonably be expected to choose between protecting their health and keeping their employment. And therefore, it falls to the government to act. The right to breathe clean air cannot be a privilege reserved for the few. It is a public good that belongs to every Belizean, and the bill reaffirms that principle. Belize has also made solemn commitments to international community, and we have ratified the World Health Organization Framework Convention more than 20 years ago. We've committed ourselves to achieving sustainable development goals, and today we have an opportunity to translate all those commitments into meaningful action. So, while this Honorable House is required to balance competing interests, for me, the choice is neither difficult nor complicated, because the welfare of Belizean families must always prevail. Mr. Speaker, the Ministry of Human Development, Family Support and Gender Affairs believes that every child deserves the opportunity to grow up healthy, that every family deserves to thrive, that every worker deserves a safe environment, that every woman deserves freedom from the disproportionate burden of preventable caregiving, that every older person deserves dignity, that every Belizean deserves clean air. And so, Mr. Speaker, with a profound sense of responsibility to the families we serve, the communities we represent, on behalf of Corozal Bay and all its generations yet unborn, I lend my full support to the Tobacco Control Bill 2026, and I urge respectfully that every honorable member of this House likewise do the same. I thank you.
As a member for Queenska.
Hi, good afternoon, Mr. Speaker. I must say it's not every time that you see both sides of the aisle agree that a bill is good for this country. And today, we on this side of the aisle certainly believe this is a movement in the right direction. This is a movement for human development. It's a movement for health care. So definitely we support it on this side. My two concerns after having the opportunity, thanks to the member from Orange Walk East, to dialogue in the process, was that we didn't see any financial control over the tobacco industry, as in if we on both sides condemn tobacco, why we don't tax tobacco so fewer people can afford it, one. And also, if the tobacco industry in the free zone continues to plague this nation when it comes to national security, why is it not a move towards banning tobacco in the free zone? Because we know the stronghold the cartels have been doing. They have been infiltrating Belize. They've been using gangs in Belize. It's really a trade in tobacco that we have to pay control of. And I know the Minister of Finance might be saying that that's a financial mechanism that needs consideration, but it's one that we believe is also overdue at this time. That's my contribution. Thank you, Mr. Speaker.
I recognize the member for Freetown.
The member for Orange Walk East, the Minister of Health and Wellness, has of course given a very comprehensive presentation today. And my colleagues on this side and also on that side have added their voices to the discussion. I certainly want to fully associate myself with the presentation made by the Minister of Health and Wellness. But I really wanted to place on record, and that's why I'm standing up today, to place on record the full support of the Ministry of Education for this bill. We have about over 100,000 young people in our education system from preschool to university. And we all have a duty to protect them. We have a duty to support them. And so we at the Ministry of Education, we have always worked very, very closely with the Ministry of Health and Wellness to advocate for our young people. And that's what this bill, in my view, represents. It represents an opportunity for us to, as a nation, speak on behalf of our young people, future generations, that we will be providing for them additional protection and support against the many, many, many negative effects, well-documented negative effects of cigarette smoking and other tobacco products. So that's my purpose, Mr. Speaker, simply to place on the record the full support of the Ministry of Education for this very, very important, historic, landmark piece of legislation. I thank you.
Thank you, Mr. Speaker. I want to place on record my full support and from the people of Orange Rock North for this Tobacco Control Bill 2026, because it's keeping up with one of our government's primary constitutional duty and moral obligation, which is to keep our population safe, to keep the people of Belize safe. And we have seen the amount of damage that that tobacco smoking has caused on the people all over the world. So thanks to the Minister for elucidating so eloquently on the far-reaching implications of tobacco and how they have been creative also in the tobacco industry, in being creative in attracting our youth, in transmuting themselves and becoming more attractive to the youth so that they can get new customers. And it is very timely, this bill. I will share a story which is just recently one of my young relatives was diagnosed with a cancer, with a tumor in his head. Thanks, it's benign, but he had a tumor in his head, and I was talking to the doctor as to what causes those tumors, what are the causes, and the doctor said, well, they haven't been able to find any specific cause for the growth of tumors in our bodies, and so especially cancerous ones. So he said, look, he said, it took about 50 years for it to be proven that that cigarette smoking causes cancer. It took so long. That's 2 generations. So we are already far behind. And you know, it's never too late to do the right thing. So that, with more reason, I commend the Minister of Health and his staff who are here with us, you know, doing a great job. And thank you for being brave enough to bring this bill to the House. And as we can see, it has support from both sides of the House, because this is our health, which is our wealth. And it is, again, I repeat, keeping up with our responsibility, our duty to safeguard the health of our people. So we need to constantly be evolving, just like how the education bill had to evolve to adapt to our changing times. This bill had to come about to fight the relentless attacks by the tobacco companies, who are very well funded. You know, if you go back to the stories, the documentaries, the literature on the history of the tobacco companies, one of the famous little anecdotes was that in a boardroom, I think one of the directors mentioned about being in the business of selling tobacco, selling cigarettes, and he said no. Another director, the CEO, told him, he said no. He said, we are in the business of distributing nicotine. That's what they said. So they use tobacco as a vehicle to distribute that nicotine. So we have seen over the decades, it's been decades that we have been seeing evidence of the harm that cigarette smoking especially has been doing to us, to our people. And it is high time that this government, the government of Belize, took action to put a stop to it, to really break what has been becoming an epidemic. And so I thank very much once more the Ministry the Minister and Ministry of Health and Wellness for doing this good service to Belize. So I support this bill wholeheartedly. Thank you.
Recognize the member for Belize Rural South.
Thank you, Mr. Speaker. I do rise also in support of the tobacco bill. And Mr. Speaker, I guess all has been said basically, especially in that brilliant presentation that the Minister of Health and Wellness said. And I believe that I think I want to reach an angle in support that to start off that I am here not standing as someone that said I never did try a cigarette. I will tell you that I still do occasionally smoke a cigarette now and again in social settings. I do, but it's a message also to them, to those that are in that kind of setting that, you know, sometimes a cigarette or a cigar, everything legal. But because I think, Mr. Speaker, I'm here recognizing my personal choice. It is a personal choice. But as an elected representative, I also recognize responsibility as an elected person. And it's about, Mr. Speaker, this, to make it clear, and I believe this firmly, and it is clear that this bill does not criminalize smokers, nor does it take away the freedom. Making it clear, it does not take away the freedom of adults to make legal decisions. What it does, this bill establishes reasonable safeguards to protect our children, our workers, and our public, and of course, indeed, the harmful effects of tobacco. But, Mr. Speaker, supporting this bill is not about judging those who smoke, but it is about balancing individual freedom with our collective responsibility to protect public health. So again, Mr. Speaker, just to make it brief and short, again, as an elected representative, there are times when a policy may affect me personally. However, our responsibility is not to support a total legislation that is going to based on personal preference, but really what is best in the best interest of the people we serve. And that is paramount here, Mr. Speaker. So, with all said, we all must rise above our own interests and support decisions that promote health, safety, as the Minister of Transport mentioned, and well-being of our nation. And just brief to say that in closing, for this reason and all, from the member of the Belize Rural South, I wholeheartedly support this bill as well. Thank you very much.
Honorable Prime Minister.
Thank you, Mr. Speaker, and I'll be very brief. First of all, I want to wish the honourable member from Corozalbi happy birthday. Still looking quite young. But and also to make it abundantly clear that I align myself with the words of the honourable member from Orange Walk East. He gave quite a comprehensive presentation. And I know it was important for him to be able to give a careful and comprehensive explanation to our citizens so they could understand what is it that we're doing. It's not about criminalizing smoking, but to ensure that we could protect those that do not smoke. I'm not a smoker. I've never been a smoker in my life. But we know that smoking is bad. And as legislators, we have a responsibility to our people. I'd like to point out to the honorable leader of the opposition when she was talking about also prevention and education, that here on there's in section 33, it gives you a number of things when it comes to education. So it is fully covered. But like in every piece of legislation, you can't cover every single thing. And so you leave it then to the actual with the regulations and the implementation of what we want to do. This bill, Mr. Speaker, is just a progression of Plan Belize 2.0. On a Plan Belize, we came up with the National Health Insurance, which deals with primary health care. We firmly believe, our government, that it is cheaper to keep you healthy than to try to get you healthy. And And that's what the NHI is all about, that you can go and get your almost free, the medical attention, especially with preventable diseases. And we've been rolling it out in the entire country. And this, we already know in the process of rolling out now completely in the Cairo district. So this continues, it's a progression of what we're doing to be able to ensure that we can keep our people healthy. We've been working closely, certainly through the Ministry of Education and the Ministry of Tourism, Youth and Sports, to be able to then to get our young people to get into healthy habits, you know, to exercise, and then we have to learn them to be able to eat properly, to eat healthy. And it shouldn't be too difficult in Belize, because most people, probably 20, 30 years ago, in your backyard, you grow some chicken, you get some eggs, you could grow some vegetables, things that we have lost. And I think that's something that we can do. I remember the former Minister of Agriculture was working on that program, especially with the schools, these, to teach them to be able to plant vegetables, and in some instances, even some chickens and some pigs for the school. So there's a number of things that can be done. As I said, I will be very brief. I support this legislation fully. And I just want also to make a point that there was extensive discussions and meetings with everyone. So there was a number of changes that were done to be able to ensure that, that this bill can work. That is a bill that, as the Minister of Health said, that 20 years from now, 10, 20 years from now, younger generations can look at us and say, you did the right thing. With that, I support this. Thank you, Mr. Speaker.
Honorable members, the question is... Oh, sorry. I recognize the member for Orange Walkies.
Thank you, Mr. Speaker. I want to take the opportunity, first of all, to thank members of this Honorable House, thank the Leader of the Opposition and the members of the other members for their support. And just in response to some of the matters raised by the Leader of the Opposition, in terms of, for us to make it clear, the law as it is evidence-based and, of course, will be supported by WHO FCTC. As well, Madam Speaker, I think you mentioned, and Prime Minister mentioned about it, in terms of education. So we have been doing this, and we'll be launching as soon as the bill is approved. In fact, what we have done as well, Leader of the Opposition, is that we have already started to go to district to district to talk about the dangers of tobacco to schools and communities. We have been putting out a very robust campaign as well that we will ensure that it is completed thoroughly and effectively to build health literacy in our people. I also believe that in one of the points you asked in terms of the higher fines, of course, the higher fines are there on second and third conviction. However, with education and sensitization, I have no doubt that we will see high rates of compliance, and that's what we're trying to achieve in this bill. The warnings on packages and this expense, of course, will come from the tobacco industry, and with many countries already on board, this will not definitely be that will not be difficult for us to achieve. One of the things I also wanted to highlight in terms of the point you talked about, I think the Leader of the Opposition may have misrepresented the extent of ministerial regulatory powers. The main provisions are fixed in the bill, in the main law, and not able to be changed by regulations. And so indoor smoking spaces are fixed. The complete bans on tobacco advertising, promotion are fixed in the law. The main requirements for packaging and labeling are fixed in the law, but regulations will allow for the consistent changing of graphic health warnings. The ban on sale of minors, for example, is fixed in the law. As you know, the industry tactics keep changing, and so the power to make regulations in the certain instances is required to respond in a timely manner. And so, however, as I said, all the main WHO CTC main provisions are fixed in the law and cannot be changed by regulation. In reference to the committee, as you mentioned, felt that it would have been much easier. And of course, in terms of transparency, public transparency, the committee will include both government and civil society. And just to answer a concern raised by the member for Queen Square, I think the section 29.3, if you look at 29.3 in the bill, it provides that the tobacco industry will not receive any favorable tax or any favors from the government, because it's specifically stated there in the section. So to alleviate the fears and concerns, we just wanted to make sure. But thank you all very much. Mr. Speaker, I ask that the question be put.
Thank you, Member for Orange Walkies. Honorable members, the question is that the bill for an act to provide for the adoption and implementation of the tobacco control policies in accordance with the World Health Organization Framework Convention on Tobacco Control, which aims to protect, present and future generations from devastating harms of tobacco use and exposure to tobacco smoke, to prevent tobacco use by children, to protect workers and the public from exposure to tobacco smoke, to enhance public awareness of the hazards of tobacco use and exposure to tobacco smoke, to ensure that individuals are provided with information to make fully informed decisions about the use of tobacco, to create a national coordinating mechanism for tobacco control, and to provide for matters connected therewith or incidental thereto, be read a second time. All those in favor, can I say aye? Aye. All those against, can I say no? I think the ayes have it.
Bill for an act to provide for the adoption and implementation of the tobacco control policies. Bill.
I now recognize the Honorable Prime Minister.
Thank you, Mr. Speaker. And I know we just finished the debate on the tobacco bill, but Mr. Speaker, it is a historic day, and I believe that the Minister of Health deserves a round of applause. So thank you. To the doctors and the other people here up there, your minister went through quite a difficult time earlier because we were going to have this debate at the next house, but he was on his knees ensuring that we can bring it today. So, but again, thank you very much to all of you. It is really historic what we're doing today, and I'm sure that it's, in the years to come, people will start to see and feel a difference from what we're doing today. But that said, Mr. Speaker, this is Development Finance Corporation Amendment Bill. I move the second reading of a bill for an act to amend the Development Finance Corporation Act, Chapter 279 of the Substantive Laws of Belize, Revised Edition 2020, to rename the Development Finance Corporation and to provide the matters connected therewith or incidental to. I have some notes on it, but really straightforward, Mr. Speaker. All we're doing is that the DFC has been going through a complete transformation, and over the past 5 years, it started off with the previous government when they recapitalized and got the DFC back on, but the previous general manager back then felt that the DFC was in their efforts to ensure that we can get things right. Back then, they shackled the DFC from doing a lot more work and be able to be more aggressive in fighting for market share. Based on her recommendations, then we made a lot of these changes. We brought it here to the House. It has accepted, and now the DFC is being recognized in the entire region for a development bank that is doing its work, that working for the development of its nation. So basically what we're doing is just changing the name from the Belize Finance Corporation to the National Development of, to make sure, yeah, so the DFC would then become the Development Bank of Belize. So I urge the support from both sides of the House. Thank you, Mr. Speaker.
As a member for Albert.
Thank you, Mr. Speaker. I rise to make a very brief contribution on the Development Finance Corporation Amendment Bill 2026. I acknowledge, Mr. Speaker, the importance of a strong national development finance institution. For decades, DFC has played an important role in providing access to credit for Belizean entrepreneurs, farmers, students, homeowners, and small businesses who might have otherwise been excluded from traditional commercial financing. The bill before us, as the Honorable Prime Minister pointed out, is relatively straightforward. Its principal purpose is to rename DFC as the Development Bank of Belize, while making the consequential amendments throughout the legislation as it relates to existing contracts, legal proceedings, assets, liabilities, employees, that these arrangements can continue seamlessly under the new nomenclature. There is nothing, as far as we are concerned, inherently objectionable about modernizing the institution's name. Indeed, the term development bank may better reflect its aspirations and align Belize with similar institutions throughout the Caribbean and Latin America. I wish to say as well, Mr. Speaker, that Belizeans are not merely interested in a new sign on the building or new stationery, a new logo, a new color to the building. Belizeans are really concerned about access to financing being improved, making sure that small businesses can continue to qualify for loans, small farmers receiving the financing they need to keep their production up. Our young entrepreneurs find it easier to secure capital, working capital for their small businesses, mortgage financing becoming more accessible, primarily to new homeowners, and loan approvals becoming more transparent and efficient. These are the things that matter to Belizeans. The purpose to catalyze national development is therefore a good one. Public confidence, as we know, is earned through integrity and not necessarily branding. As legislators, we have the responsibility to ensure that any public financial institution remains insulated from political interference. Loans must never be granted based on political affiliation or personal relationships. They must be granted on merit, viability, and the public interest. Mr. Speaker, as we consider this amendment, I encourage the principals at the board at DFC, now soon to be National Development Bank, and of course our government, to look beyond the change in nomenclature. We've always needed, we continue to need a comprehensive vision for development finance in this country. We need an institution that supports innovation, expands opportunities in agriculture, in tourism, in renewable energy, in housing, in education, in the digital economy, while maintaining the highest standards of financial discipline and governance. DFC has come a long way. And if the new development bank is to succeed and continue building on its success, it must become a trusted partner in national development, one that is professionally managed, financially sound, and accessible to all Belizeans. The opposition, those of us on this side, will continue to support measures that genuinely strengthen our national institutions, improve access to finance, and improve sustainable economic development. Changing a name, a logo, a color on a building is easy. Building stronger institutions mean that we need to be intentional and deliberate in delivering meaningful results for the Belizean people. It is a challenge, but one those of us on this side are prepared to support. Thank you, Mr. Speaker.
As a member from Mesopotamia.
Thank you, Mr. Speaker, and good afternoon, everyone. I know you get a bit sleepy and drowsy in here, but afternoon. Mr. Speaker, permission to refer to my notes, please. Mr. Speaker. It's simple. It sounds simple like a name change, Mr. Prime Minister. But what about the past? Why the name change? Why we want to change this name? So we have to sometimes look back into the past and see what happened, why we want this name change. No, Mr. Prime Minister. No, all this piece I omitted quite a few of it and summarized it up a little bit. Mr. Speaker, this bill appears very simple. It changes one name. The Development Finance Corporation becomes the Development Bank of Belize. New signs, new letterheads, new logos, new advertisement, new websites, new name. But Mr. Speaker, changing a name is easy. Changing a culture is hard. Changing governance is much harder. Changing accountability is even harder. And changing history is impossible. Before Parliament gives DFC a new identity, Parliament must first remember its old history. Minister, we are going to talk about our past history now. You don't worry me, Bali. You know, Bali, I had to wait for make you come and tell me I can't talk about this. But thank you very much. Thank you, Mr. Prime Minister. It's still about DFC we're talking about. Once we stick to the topic of DFC, Mr. Speaker, I think we're on the right page, right? Thank you.
Speak about name changing the name. That's all we'll talk about.
Yes, I know we're talking about the name change, Mr. Prime Minister, but then we also need to know why all of a sudden we need to do this name change. Reputational risk, yes, and we need to bring up back also what happens in the past DFC and why we have to do all this name change right now. And Mr. Speaker, I mean, you could be the judge of what I present and we could move on. The minister take an hour and a half just now, Minister Hill just now, an hour and a half. No, I agree. I agree with it. Because this bill is not only creating a new institution, the bill itself makes that very clear. Every agreement remains the same. Every contract remains valid. Every legal proceedings continue. Every asset becomes an asset, but the bank renamed. Every employee is transferred. Every benefit continues. All that really changes is the name. The same institution, the same property, the same agreement, the same obligations, the same employees, but different name. So why does the government believe this institution needs a new identity, Mr. Speaker? The opposition position is clear. The government wants to separate the new Development Bank of Belize from scandal, failures, controversies, and political baggages attached to the name Development Finance Corporation, DFC. They want Belizeans to hear the Development Bank of Belize, DBB, and forget what happened under DFC. They want to change the labeling without debating the failures that made the old labeling so damaging, DFC. But Belizeans remember, the name DFC became associated with political interference. It became associated with insider influence. It became associated with related party transaction. It became associated with loans that did not perform. It became associated with projects that lost millions, Mr. Speaker. It became associated with assets carried on the books that values far above what they could realistically produce. It became associated with scrutinization deals and government guarantees. It became associated with a commission of inquiry for the DFC. It became associated with a forensic investigation. It became associated with hundreds of millions of dollars in liabilities eventually assumed by government and therefore by the people of Belize. Our money, Mr. Speaker. The public record shows that DFC crisis resulted in a commission of inquiry, forensic auditing, restructuring, recapitalization, legislative reform, and temporary cessation of lending. Mr. Speaker, a new name does not erase history. I guess that's probably what they're trying to change the name, so they can try to forget the past. It merely tries to place distance between the new brand and the old scandals. Today, I will go through some of the major controversies individually, not rumors, not barroom gossip, but as matters examined through official inquiries, forensic work, international financial assessments, public testimony, and the historical records. Between 1999 and 2004, DFC expanded its lending financial operations at a pace that its governance, controls, and financial conditions could not sustain.
And a point of order. Mr.
I recognize the member from Orange Rock Central.
Thank you, Mr. Speaker. This bill speaks specifically only to a name change. We're not talking about the financials, about the history, about the future, simply about the name change, and I would wish that the member from Mesopotamia would stick to what the debate is about. Changing the name. Either he supports the name change or he doesn't support. I don't think we need to go through all of that. That's not a part of what this bill is all about.
Mr. Speaker.
One minute, member. I would like to remind you of Standing Order 38. Subject to the provision of these standing orders, debate upon any motion, bill, amendment shall be relevant to such motions, bill, or amendment, and a member shall confine his observation to the subject under discussion.
Mr. Speaker, my discussion is confined to DFC. DFC has a past. Why do they want to change the name today? Give a reason why. I am speculating and I'm telling the public why they want to change it. It's because of all the past and previous scandals, Mr. Speaker. They don't want to hear about the past, but they like tell me about the past. No, we try to tell them about the past right now.
Yes, member, but you need to confine your discussion
about speculating. We're talking
to the
about
amendment.
Change. That's
specific to the amendment.
Mr. Speaker, everything that I speak here is about DFC and the DBB, the new bank and the old bank. I have a right to speak about the past. I have a right to speak about the DFC. You cannot shut me down, Mr. Speaker.
Member, I will allow you to proceed, but please confine your discussions to what the amendment is about.
The amendment is about the name change, Mr. Speaker, and reason for the name change, and that is what I am presenting at the moment. So can I continue, Mr. Speaker?
Please continue.
Thank you. So I might have to give one of these dose of our own medicine. That's what I tell the minister over the side there. Just today I hear when you talk about the past today. Mr. Speaker, I know they have to quarrel nobody today. Mr. Speaker, I have to make a presentation, Mr. Speaker.
Please proceed, proceed with the presentation.
Thank you, Mr. Speaker. And the thing is that it is relevant. No worry, I know this entire notes, right? I made some amendments. If I had, I think it was like 15 different scandals. And I explained each one of the scandals under DFC. Right now, they want to change it to DBB, but as of right now, it is still DFC. So, but I have shortened it. I have shortened it, Mr. Prime Minister. I have shortened it. It's going to be. I know it's going to be a long night, but
please proceed. Please proceed, member.
Thank you. Between 1999 and 2004, DSP expanded its lending and financial operations at a pace that its governance, control, and financial conditions could not sustain. Large loans were issued. Large projects were financed. Mortgages were packaged into international financial arrangements. Government guarantees stood behind major obligations, but too many loans were not performing. Too many assets were not producing the values reported to the books. Too much risk being transferred to government at a day, Mr. Speaker. By 2004, approximately 35 to 40% of the portfolio or assets was reported as non-productive or non-performing. DFC stopped making new loans and entered a process of restructuring and possible wind down. This is the past DFC. So, Mr. Speaker, and I will explain again. I am just explaining and letting the public know the government wants to change the name from DFC to DBB. Why? Tell us why, man. All the bills say that they change the name, yes, they change the logo, but they still keep everything intact except the name. Probably might change the colors too, but the IMF recorded that DFC assets and liabilities were reduced from more than $300 million to approximately 100 million during the restructuring. It also reported that government assumed responsibility for approximately 210 million in DFC liabilities, Mr. Speaker. You know how much are $210 million? $420 billion are write-off. Money that government had to, not the government, the people of Belize had to swallow because the government lost that money and couldn't have spent it on the people. Big pills? And that probably is part of the reason why we had to go to the super bond now. DFC took risks, made the decisions. DFC booked the loans. But when the institution could no longer carry its obligations, the burden moved to government. And when the burden moved to government, it moved to the taxpayers. That money that could have been available for classrooms, money that could have been available for hospitals, money that could have been available for roads, housing, farmers, legitimate small business, etc. The collapse contributed to the accumulation of public and publicly guaranteed debts. It damaged Belize's reputation with international lenders. It restricted the government's financial flexibility. It reduced public confidence in state-owned financial institutions. It temporarily deprived ordinary Belizeans of a properly functioning development finance institution. You hear me what they say, Mr. Speaker? That's probably one of the reasons, or these are some of the reasons why they want to change the name. Because they don't want to be associated with DFC no more. And it'll be DBB as after today. But as of now, it is still DFC. A development bank cannot be treated as political lending window, Mr. Speaker. It must remain financially sustainable, professionally managed, and protected from political interference. Reform required today. The renamed institution should be required to publish its non-performing loan ratios. Give the courtesy.
Go ahead, member.
Its largest sector exposures, its government guaranteed liabilities, its annual write-offs, loan restructured more than once, and any concentration involving connected borrowers. And the chairman was there. We had a committee meeting with him, and I must admit DFC has done much better than in the past, in recent times. More scrutiny, better management, and I guess that is one of the reasons why they wanted to move. Excuse me, Minister? I know, and that's why I talked to Mr. Speaker right here. You hear me, right? Thank you. I don't need to read. Thank you.
Member,
yes, Mr. Speaker, my apologies. I continue. One of the most prominent transactions examined by the Commission involved approximately 30 million lent to the Novelos Holding or the Novelos bus operation. DFC, Mr. Speaker.
Member, I must ask you, as you continue with your presentation, the amendment that we're discussing is the amendment of the name. You're not confining your presentation to what is relevant to this amendment.
Mr. Speaker,
please confine it to what is relevant to the amendment.
We are speaking about the name change of DFC to DBB. We have a right to know why the government and DFC want to change their name from DFC to DBB. We have a right, but Mr. Speaker, you are the chair. If you tell me sit down now and that my presentation is irrelevant, right, I'll just tell you. You can tell me and I'll be quiet and I'll sit down. But I have a right to present what it is in that scope, DFC, the past history. We talk about from 1999 to 2004, 2005. Excuse me, what happened today? Don't worry, man. You have an opportunity, right? After I'm done, and if I miss anything, you could add it in, Minister. Right?
Member from...
Mr. Speaker, on a point of order. 38-1, relevancy.
Member from Fort George.
38-1, standing order 38-1. It's very clear what the standing order says. The relevance must be to the bill being debated. I have looked through, it's not a long piece of legislation, amendment, 4 pages. The papers that the member from Mesopotamia has is longer than this piece of legislation. I'm just asking, where is he getting this information from this bill to be debating? Debate what is in the bill. You must know the rules and procedures of the House, Mr. Speaker. 38-1. Thank you.
Member, in regards to the point of order, I think I have shared it before.
Mr. Speaker,
please
point of order, Mr. Speaker.
The remainder of your presentation to only what is...
Mr. Speaker, you are telling me that DFC name change and the DFC history and why they want to change the name. Because nobody will give no presentation right here on the paperwork that why they want to change the name. Tell me why they want to change the name, but they keep everything else. The accounts, the employees, everything except the name. All I'm doing, Mr. Speaker, is giving the people of Belize an explanation as to why the government might want to change the name. And it's associated with 15 minimum different scandals from 1999 to 2005.
Mr. Speaker, just a clarification. If the honourable member would only...
Member from Orange Central.
Yes. If the honourable member from Mesopotamia, when I introduced the bill, I explained why we're changing this, We already told him, but look like he can't remember. He can't even remember what we spoke at the last house meeting. I have explained that before. I have it ready. I could have read it all over again, but I was thinking that we talk with some adults, but they don't look like they understand what we're talking about. But when you finish, I will explain it to you again. Hopefully, you will capture what we're trying to do here. And this is not something from the government. This is a recommendation from the Board of Directors of the DFC. And as you all know, the Board of Directors of the DFC is managed by professionals. But the only appointment I think I can make is probably the chairman. Nobody else. It's legislated who could be on that. So I don't know what else to be able to tell to the honourable member from Mesopotamia, but you already explained it. And I wish you could just get to the point whether you accept it or not, and we move on, man.
Mr. Speaker, first and foremost, I hear and I listen, and I have a right to present what I believe it goes to the DFC, that's connected with the DFC, and why government might want to change the name of the DFC. Because they tell me I saw the song. Not because they tell me the sky blue, the blue. It could be white with clouds in the day. So, Mr. Speaker, I now interrupt nobody from making any presentation. Once I am relevant to DFC and DBB, Mr. Speaker, I believe you should allow me to continue.
Member, I think we've heard 2 points of order before.
The last time, but he has 6 last time, Mr. Speaker.
Please allow me to finish. We have heard 2 points of order from Standing Order 38.1, and I will repeat it for the last time to you. The relevancy of the amendment that was tabled and that is being debated, and also confine your observation to the subject under discussion. I will ask you, member, I know you were given okay to utilize your notes, but I will ask you to please wrap up your presentation based on what is being debated.
We're talking about 15 different individuals' scandals. The dates from 1999. And I'm a young piece of boy at that time. You think I can remember all of that, Mr. Speaker, out of the mid of my head? I asked to review my notes, Mr. Speaker, because I have all my notes right here, including the forensic audit, including those appointed people that are directors on the board, including the lawyers. All of that is explained right here, no? All I'm repeating this today, Mr. Speaker, is because I do not want DFC or the new DBB to go down that same road. We need to bring awareness to it, Mr. Speaker. Right? This is relevant. This DFC, it is still DFC today. Until we finalize this meeting today, it's going to be DBB tomorrow, but today it's going to be DFC, Mr. Speaker. And I'm talking about the past. Yes, I'm speculating, but it is facts. These are all factual statements that DFC, that happened at DFC. All factual statements.
Members of the House, can we please allow the member? I see a point. Is there a point of order from the member from Toledo?
Mr. Speaker,
please take your point of order so I can sit.
You're not the speaker.
Well, no, but I'm telling you so you can sit.
Member from Mesopotamia.
Well, I'm not yielding if he not says point of order, Mr. Speaker.
I have already requested the point of order. Can you please allow him to state his point of order?
Thank you. Mr. Speaker, the honorable member is being repetitive and contradicting himself. He just said that he is speculating, that he's presenting facts, but that he may also be speculating. I mean, he has been repetitive and repetitive. And the Prime Minister made it absolutely clear in his presentation why the need for the change.
Speaker, I know you told me just now that you have 2 points of orders. The last time I believe I made a presentation had 6 points of orders, Mr. Speaker. And that never stopped me, Mr. Speaker, because I will say what I have to say, you know. Even if I have to do it on the adjournment, Mr. Speaker.
So please proceed with your presentation, member.
Thank you very much, Mr. Speaker. I appreciate that. And believe you me, sometimes, you know, they brother, they try. In fact, make us be quiet. Make us get to the point. The forensic auditor, Mark Halls, testified that the loans did not perform. We talk about from $300 million US to the value of only $100 million. We lost $420 million, Mr. Speaker. That is worth some time. 420. Even if you company by $1,000 bills, it will take you some good time. He further states that its non-performance appeared to have been concealed through the creation of new loan accounts, which also became non-performing. You see what they do, Mr. Speaker? They go open one account, go borrow one money, and then they go borrow against it again and again, right? Without the actual verification of the security. After assets held as security were sold, approximately $27.5 million reportedly remain outstanding. They borrowed $30 million. And by the time they don't finish sell off the assets and evaluate, estimate, and all of those checking of prices, they still owe $27.5 million. Or that $30 million. The audit identified breaches of procedures, protocols, fiduciary duty, as well as conflict of interest concerns. A loan of approximately $30 million dispersed under circumstances that became the subject of a national inquiry under DFC, the largest loan in DFC history at the time. And after collateral recoveries, roughly $27.5 million reportedly remained outstanding. The Commission's report later criticized the transaction and referred to the loan being approved for payment in 1 day, without the normal DFC guidelines being met, was involved. The borrower was Novello Business Group. The forensic evidence raised concerns about whether businesses and professional interests connected to the chairman benefit from the transaction. Those involved disputed aspects of findings and presented explanations during the inquiry. Parliament should therefore distinguish the audit's conclusion from the responses given by the persons affected. You see, Mr. Speaker, all of these things right here, Mr. Speaker, happened. When the last time you hear of a national inquiry to investigate those, you know, like serious matters? Yeah? And the BDF want to be next? And the BDF want to be next? And the other want to be next? If you want, you could get up. If you want, you could get up and talk about it, Minister.
Member from Mesopotamia, can you please proceed with your presentation?
Yes, but then you also, Mr. Speaker, you sit and heckle me, you know. But anyway, we can continue. DFC was carrying a massive bad debt. The public transportation industry was destabilized. Mr. Speaker, I just want to make one thing clear. My name is Lee Mark Chang. Right? And if you want, you can put the HO in front. Right? Throwing other, whatever name or speculative name after me will not stick. If they bury Lee Mark Chang, I go in my grave. Yeah, no, I just tell you. Yeah, I know, I feel it. Well, we are a while, no worry. I'm just thinking about cutting down upon the notes, but DFC was left carrying a massive debt. The public transportation was destabilized. The value of security provided inadequate to recover the outstanding balance. The bus terminal, the bus company, no, Mr. Speaker. Public money that should have revolved into loans for many Belizeans became tied up in one enormous failed exposure. No single borrower should be allowed to place a public development institution at risk. There should be a signatory single borrower limit, compulsory independent valuation of collaterals, a prohibition against one-day approval and disbursement of $30 million or major loans. Recorded votes for all board approvals above a fixed threshold, and automatic external review of any loans exceeding $5 million. Listen, Mr. Speaker, I also try to bring recommendations so we don't go back down the road again. I know I'll go back down the wrong road. Until please don't go back down the road right here. All I'm doing is stating the past so it can be fresh enough in mind that what has happened in the past can still happen today unless we make changes and make sure that it does not happen again. It can't be swept underneath the rug, Mr. Speaker. The Novello transaction also raised serious concerns about legal work and fees connected to the loans. Evidence presented to the Commission referred to estimates of approximately $1.74 million in professional fees, taxes, recording charges, and related expense. The Commission heard conflicting testimony regarding which law firm performed the work and how the funds were distributed. And I never get into the details of it, because it would have been real all day, but we'll continue. The Commission published findings later referred to serious conflict of interest, including a situation in which a law firm advising the borrower was associated with DFC chairman at the day. The central issue was not whether a fee was legally payable. The issue is whether the chairman of a public lending institution or firm and professionals connected with him stood to benefit from a transaction that he helped influence or approved. DFC have a chairman, they have a board, you know, and the board does a collective decisions who they are grant the loan to and who they not grant the loan to. And when you borrow the money, you must make sure you have that security ready for back that up. Because if you borrow $100 and your security only worth $5, you think they are give a $100 loan? The forensic review identified apparent related party dealings involving the former chairman, his legal practice, and financial institutions in which he reportedly held interests. Horst testified about $5 million loan that attracted approximately $805,000 in interest over 5.5 months. In effect, annual trade rate he calculated at approximately 17.5%. Wow.
Point of order, Mr. Speaker.
I recognize the member from Orange Walk North.
Point of order, 44-1. Says the Speaker, after having called the attention of the House to the conduct of a member who persists in irrelevance or tedious repetition either of his own arguments or of the arguments used by other members in debate, may direct him to discontinue his speech and resume his seat. You have called his attention to such irrelevance, Mr. Speaker, because it's irrelevant, it's just a name change bill.
Right, member from Mesopotamia, I will reference the standing order that the member from Orange Walk North just read. while I understand you are trying to justify, while I understand you are trying to reference, your presentation of the debate must be confined to the presentation. And let me finish. I ask that you please, I have allowed you to utilize your notes. I ask that you please use your paper and your speech and reference excerpts from it and reference notes, but you continue to read. And while we understand you have referenced some example, please.
You know what is a third or fourth point of order? Do you know what is a fourth point or third order? Because this involved $400+ million about 25 years ago, 20 to 25 years ago, that we, the Belizean taxpayers, paid. Not them. We, the Belizean taxpayers, paid that money. They want to shut me up because they don't want to hear the truth. Those scandals are real, Mr. Speaker. Right? You cannot deny the fact that this is the history of DFC, and that is why they want to change the name to DBB. Ladies and gentlemen, ministers of government, it hurts me if I have to bring back up their things, you know. Why you going by? I think about ×2 right now. And the inflation and all the cost of goods and everything. Yeah. No, I know. I tell you.
Remember your present.
Respectful to everybody, and him call no name.
Member from Mesopotamia, you're not sticking to the debate topic.
Yeah, make a be respectful, man. Make a be. You know, I make a be the bigger man. So, Mr. Speaker, you hear my rationale why I want to bring up, yes, it's a past. It's about 20 to 25 years ago, Mr. Speaker. It cost us $400+ million. And Uno wants to sweep this underneath the rug, Mr. Speaker. We don't pay for it already as a country. You can't give me half an hour to hour for when I speak about it? We still pay. $400+ million, Mr. Speaker. $30 million in one day. From $300 million that in terms of loans and everything, come down to $100 million. Losses. Please. Because I don't want to pay for it. Another major issue examined during the commission hearing was a controversial $50 million transaction involving DFC and the Belize Bank. It became known publicly as the ghost money transaction because witnesses questioned whether there has been an actual movement of cash corresponding to what appeared to be on the books. Everybody, these are real stuff in here. I think Uno might need for mind how to deal with the Belize Bank. Don't forget to still got a smart deal over on the head, you know. Remember, still got a smart deal over on the head, you know. You see, Mr. Speaker, when then they tell me thing, you not telling nothing. But when I tell anything, then you will look at me and say, I need to stick to my position right here. Mr. Speaker, don't get me wrong, you know. I know you got a job to do. But just make it be fair. Just give me at least 60-40, you know. It can't be the 90-10. Can I continue, Mr. Speaker?
Member from Mesopotamia, I'm allowing you to continue and you're allowing
Speaker,
the distraction. Please continue with your presentation.
Thank you, Mr. Speaker. DFC was involved in a series of mortgage scrutinization operations between 1999 and 2002. In simple language, DFC bundled mortgages and future mortgage payments together and used those expected payments to raise money internationally. The IMF reported that DFC and Social Security Board raised approximately $150 million through 5 scrutinization operations. The most controversial involved $45 million loan from a United States bank, Mr. Speaker. Part of the money was on lent through a domestic financial institution to 2 local companies with ownership ties to the senior DFC management. DFC Board of Directors, Mr. Speaker, previous ones. The scrutinization operations were not limited to DFC funds. The Social Security Board was also involved in financing or supporting mortgages arrangements connected to DFC. That meant workers' contribution and national retirement resources became exposed to the same system of weak lending, poor performing assets, and government-backed obligations. The IMF identified both DFC and SSB as institutions whose governance and contingent liabilities required investigation and reform. The IMF also documented the wider financial controversy involving Intelco. The founder and owner of Intelco was also the chairman of DFC. The government awarded the company an exclusive service contract and provided loan guarantees. That's why they don't want to say it, Mr. Speaker. And there's so much people to put down here because I just say, you know what, we're not going all night. Thank you, Minister. The forensic report highlighted numerous delinquent accounts where normal lending standards were reportedly not followed. Examples identified in the inquiry included New Millennium Enterprises Limited, Aqua Marine Suits Limited, Print Belize Limited, Royal Palm Limited, Toledo Free Zone, and other substantial borrowers connected, including incomplete loan files, weak due diligence, insufficient security, proceedings being bypassed, conflict of interest, and loans remaining outstanding without effective enforcement. You see why all this is important, Mr. Speaker? That's not a simple name change, you know, Mr. Speaker. That's the process of how you're going to borrow money. And when the guys, they skip certain security measures, that we, the people, end up have to paying and footing the bill, Mr. Speaker. The Commission report identified the Novelas family, Aqua Marine Suites, Royal Palm, New Millennium Enterprises among borrowers whose loans display breaches of procedures, fiduciary concerns, or conflict of interest. Every delinquent multi-million-dollar loan reduced the fund's availability for legitimate development lending. That's the purpose of DFC, for lend money to the people at good rates and make sure you have your security and make sure we can grow the economy. So if you want to change the name, you want to give a point of order, Minister? Just say a point of order and I'll sit, you know. DFC invested in or financed several housing and land development projects that later required major write-offs, Mr. Speaker. The projects identified during the forensic review included,
Father, Mr. Speaker, in accordance with 44.2, I move that the member be no longer heard. Based on the fact that you, Mr. Speaker, have called the attention of the member, and he persists in irrelevance and tedious repetition of his own arguments.
I guess the ayes have it, Ocho. Mr. Speaker.
Member from Mesopotamia. I know.
Mr. Speaker, if DFC could the name change.
Member, please allow me a minute, clerk. Please allow me a minute.